Thanks for joining us here on Queen City News Plus. I'm Alicia Barnes. It is Fibroid Awareness Month, and we're going to talk about all things dealing with what ladies need to know when it comes to fibroids, because for so many of us, you don't find out about fibroids until you're trying to be able to have a baby or you realize that you need a hysterectomy. So here to talk about everything that deals with this under this umbrella, I want to be able to bring in our special guest, Dr. Crystal Carmichael, who's with the Piedmont Physicians Network out of Fort Mill. Dr. Carmichael, I'm so excited that you're on with us to talk about this, because this is something, as I said, for so many women, they have no idea what a fibroid is.
Yeah, that's so correct. And, it affects so many women in so many different ways. Like you hinted at before, a lot of times you don't even know, hey, I have a fibroid. What is a fibroid? Until your doctor tells you, hey, you have anemia.
Mm-hmm.
We probably need to look at your cycles, your menstrual cycles a little bit more. Or, hey, I've been trying to have a baby. I've been having multiple miscarriages, or I can't get pregnant at all, where that actually comes to your knowledge once we get the imaging and we actually do the workup for abnormal bleeding or for infertility. So it's something that is super impactful for a lot of women. Their quality of life, their ability to start families, their ability to maintain their health, as far as, being plagued with anemia, needing blood transfusions, that sort of thing. So I'm so glad that we have a whole month dedicated to fibroid awareness, which is July.
Yes. And so let's start with, what is a fibroid? Because for people listening right now, whether they're in their 20s, 30s, 40s, let's start there. What is it? What are the symptoms that allow you to know, what, this is something I might need to get checked?
Yeah, so that's a great question. A fibroid is a benign muscular tumor of the uterus, so a woman's womb. It's one of the most common benign tumors that a woman can have. And honestly, if we were to look at all of the women in the world, maybe about 70% of women would have a fibroid. And a lot of times they're nice and small, they don't cause any issues. Like I hinted at, 99.9% of these things are going to be benign. But it can become problematic. And I would say, about 25% of the time they can become problematic, where they cause serious issues for a woman's health and a woman's life, as far as painful cycles every month,
Mm-hmm.
as far as very heavy bleeding every month, where you're having anemia, you're having to take iron pills or even a blood transfusion, right? Getting admitted to the hospital. Another one, if the fibroids grow so large, they can compress your bladder, they can compress your rectum. All of a sudden, now you're having issues with urination, urinary frequency, or constipation. Another big thing, right, is going to be your pain, right? That's definitely going to be one of the main factors that someone would walk into the office like, every month I am missing work. I can't interact with my kids. I can't do my normal activities. And typically with fibroids, they're hormonally active, so they tend to get worse as we get older. They're very slow growing. So a lot of times women in their 30s and 40s, those are the women will be, the ones coming into your office like, hey, every year for the past 5 years, my periods have gotten so bad where I cannot function.
Right.
Right.
So let's talk about, what do we do when you realize that you do have fibroids? What's that process like? I know there's some new ways. I've heard of the myomectomy. That's what I personally had to go through when I was trying to be able to have kids, when I found out that I had fibroids. But there's some new procedures out there that I guess aren't as invasive. Explain those to us.
Yeah, so every woman that walks in and they have fibroids, like I hinted at before, a lot of them don't need any treatment. They have no symptoms. But the ones that are symptomatic, where their quality of life is being affected, those are the women that may need treatment. And so sometimes we can watch and wait. Sometimes it can be as easy as medical management, whether that is, Tylenol, ibuprofen, or whether that is some type of hormonal management. Or, for women who have really large fibroids, or who are seeking fertility, um, or now, they're coming in and out of the emergency room needing a blood transfusion. Those are the women that may need a surgical procedure.
Okay.
And so traditionally, as you hinted at, women who want to preserve their fertility, myomectomy was the go-to. It was the gold standard. It still is.
And that it
But
was
that's
very
the
invasive
more
because,
invasive.
right, the recovery
Exactly,
of that,
invasive.
it was almost like getting a C-section, of them being able to cut and actually go in.
Absolutely.
Very invasive. The downtime, the recovery time, um, very, very lengthy.
That's right. Myomectomies can be extensive surgeries. You're going to lose a lot more blood. The definitive management for a lot of women, once they're done with childbearing would be something like a hysterectomy. That's
Mm.
still like a myomectomy where you're going to be down. You have a lot of downtime, right? A lot of recovery time. So a lot of women like these minimally invasive options, right? That get them back to work, get them back to their lives in a couple of days, or up to 4 to 5 days, right? They're back to work. So the new ones that came out probably around 2017, 2018 are what we call radio frequency ablation of fibroids.
Mhm.
And so the Sonata is an incisionless procedure, where you go through the cervix. There's no cutting on your abdomen at all. And we stick a hysteroscopic needle through the fibroid to heat that fibroid up, to a certain degree, where pretty much this fibroid that's hard like a baseball, very much a lot of blood supply, now becomes very soft like a marshmallow.
Hmm.
And the blood supply to it is essentially gone. And so the other minimally invasive procedure that is basically like the Sonata would be the Acessa. The difference is the Acessa has been around a little bit longer. It's a little bit more well studied, and that's laparoscopic, meaning you're going to get two little small incisions in your belly, to be able to complete that procedure. But it's the same thing. We're using ultrasound guidance in both Sonata and Acessa to be able to map those fibroids, and then we stick a laparoscopic needle for the Acessa into those fibroids and heat them up to a point where they get soft, right? And they go away.
So is it the doctor for you, like for you to determine what the patient needs, or is it the patient figuring out, do I want the Acessa versus the Sonata, or how does that work?
Absolutely. I think it's both the doctor and patient, right?
Okay.
So I always make a point to make sure that I'm explaining all options to my patients. But the real deal breaker is going to be, where are your fibroids? Are there more so on the outside of your uterus where it's easier to access it abdominally, or are those fibroids, inside the uterus or closer to the lining, where it's easier to access it through the uterine cavity? And so, that would be my main, kicker.
Concern.
Or this person, they really don't want laparoscopic surgery. You might be down for 4 days, versus the Sonata, you're probably down for 24 hours because you have no incisions on your belly.
So we talked about how for so many people are trying to have a baby, with fertility and everything, how fibroids then all of a sudden come into play. For so many people, they're like, oh my goodness, I had no idea this is the reason why I'm not getting pregnant. With the new procedures that are out there, what's the downtime of when you can then start conceiving? Is there a difference of the two new procedures?
So there's not a lot of fertility data yet
Okay.
for the radiofrequency ablation of fibroids. It's coming out now that women are getting pregnant after these procedures and doing wonderfully, right?
Okay.
There's no issues to their pregnancy. They're having full term deliveries, no issues with bleeding, or uterine rupture. That's where the uterus can kind of come apart. When you are pregnant, it's a serious, obviously, issue that we will want to avoid. So we need more data. We're waiting on that literature, and it's not technically approved for women seeking fertility, but
Okay.
obviously we know it's a uterine sparing procedure, right? Your uterus is intact. The needle is so small that it's not really going to cause any issues. So we're waiting for that literature and that data to come out, versus our traditional myomectomy. We know that's a fertility sparing procedure
Mhm.
that is indicated for women who want to proceed with pregnancy after removal of fibroids.
And
But with the
what kind of
myomectomy,
time
you
frame
said,
I'm sorry. What kind of time frame just so people can kind of lay that out. So when you get a myomectomy surgery, the recovery versus you then trying to be able to say, you know what, your doctor's saying it's a good time for you to be able to start trying again.
typically we would say 18 months. Give your uterus about 18 months. So that's over a year. It's a little long time. But make sure that those complications like the uterine rupture or preterm labor, preterm delivery, those things are decreased, right? Those risks are decreased for you.
And it's also important to note that fibroids can grow back. Whereas when you get them out, if you can talk to us a little bit about that, because that was my situation where you took out these humongous fibroids. And I'm like, okay, great. Now I can start having a baby. But that's not always the case. When your body recovers, there could also be that they grow back.
That's right. Traditionally myomectomy has a little bit higher recurrence rate for your fibroids to grow back,
Mm.
versus our radiofrequency ablation methods or 5-year reintervention rate. So that means that the patient has to do something else to get rid of new fibroids is about 11 to 15% with those radiofrequency
Mm.
procedures. Myomectomy is a little bit higher. But it is obviously a concern always in the back of your head. That's one of the things you counsel the patient on. Like, if we do this procedure, I wouldn't wait 10 years to have a baby. I would probably have a baby within the time frame, wait your 18 months for healing and then go ahead and start trying.
Mm. Well, it's Fibroid Awareness Month for the whole month of July, which I just think is so incredible that people are at least talking about this. What other message do you want to be able to get out to let people know? Is this a conversation that patients bring to you, or is this a conversation that you just kind of work with the symptoms and say, you know what, we might want to check into this?
I definitely think a lot of patients are shocked when they come in. And, they've had an issue of, yeah, I've been soaking through my pads or I haven't been able to go to work during my cycles. And they find out that they have a fibroid. And so I love Fibroid Awareness Month because it puts that message out there that, hey, this is not a normal period. You may have something going on with you that could affect your fertility later on, or lead to anemia, constantly needing those blood transfusions. So, I think it's important for you to just get your checkups, right? Come get your preventative exams, make sure you're getting your annual exams, staying up to date on your pap smears, your pelvic exams. So that way, we can find things for you before it actually becomes an issue. But on the other side of things, if you're missing your work, you feel like your period is not normal, just come get checked out,
Yeah.
come get checked out. And I feel like a lot of times our, patients are worried about cost. They're worried about, what is this procedure going to cost me?
Mm.
How is it going to cost me in my time off of work and, my money? So those are conversations that certainly we want to have with you. There's a lot of financial payment plans, that sort of thing,
Mhm.
even with people losing their insurance and that sort of thing these days in time. So we want to make sure that we're promoting access to healthcare to everybody.
The last question I had for you is, does this affect different demographics or in terms of cultures? I've heard like within the African American community, is there a higher risk of fibroids? You hear things out there. It has to do with getting relaxers in your hair. I mean, all these things. Are there any truths that you can give us as to what kinds of things people have heard about fibroids?
Absolutely, there are disparities that we see in fibroids. African American or Black women are have a higher frequency, right?
Mm.
We see that more in our Black women, especially if in family members, right? It tends to run in families. My mom got a hysterectomy, my grandmother, all for fibroids, right? All for abnormal bleeding. So those patients should kind of have a higher suspicion for, oh yeah, my periods are really heavy. Maybe I should go get checked out.
Mhm.
But yes, we do see a disproportionate frequency or incidence in Black women with fibroids and having worse complications, or they're the ones that have a lot of the anemia complications or needing the surgical complications, versus other races, right, where they may only need hormonal management or medical management. So that is something that we see, and it's good to get the word out. So, like I said, all have equal access to healthcare.
Does that mean that you should look for detection earlier, or does that mean that you just kind of keep an eye on it, as you said at the beginning of the conversation earlier, even though you might not have a patient who has fibroids? It's like, you know what, let's keep monitoring this.
Yeah, I feel like the earlier the detection, the better, because then we can kind of keep an eye on it. A lot of times it takes 15, 20 years to actually grow and cause symptoms. But for some women, it starts when they're, in their 20s, in their early 20s. And so what clues you into that is, hey, I've had this anemia since I was a teenager. I've had these really long periods. They're very heavy. They're very painful. I'm missing work. Or, hey, I'm, got a partner that I want to have a baby with. We've been having recurrent miscarriages. Those are the people that definitely should seek medical advice sooner rather than later.
Oh, Dr. Crystal Carmichael from the Piedmont Physicians Network out of Fort Mill. I just appreciate your time. Is there anything else that I did not ask you that you want to make sure that people are aware of?
No, I think you asked me very thorough questions. I'm just grateful to have the opportunity to kind of talk to the community about fibroid awareness and making sure that they, come get checked out.
Oh, we just appreciate your time. Thanks so much for joining us on Queen City News Plus. I'm Alicia Barnes.
Queen City News Plus. Just search Queen City News on your smart TV's app store.